All right, it is almost, we will get started within the next 30 seconds. I just want to say, as we start to get kicked off here on the session, I see folks, good morning from California, good morning from Arizona. I'm so excited to see some names that are so familiar to me, and I'm equally as excited to see names that are not familiar to me because I have not met a person through CADCA that I haven't loved. So we're really excited to have this opportunity connect with you today. We are up to 255 participants on the call. And so one of the things I just want to say before we get started is if you've ever been in a training session with me, no matter how big it is or how small it is, I want to make sure that everybody feels comfortable in the learning environment. And we're in a crazy virtual classroom today, but I want all of you to just think about it as it's just you and I on the phone. So or on the online. So I want everyone to feel comfortable participating. I want everyone to feel welcomed. And one of the things that I have seen over this COVID period of time is more than ever, all of us as coalitions are in it together. And so I want everyone to feel comfortable as we go through this conversation. And I'm so excited. We've got, I'm so excited. I'm going to click off the chat for just a minute because otherwise I'm going to get so excited about the folks that are on the call. So today what we're going to talk about is staying engaged during COVID-19. And now that it is 12:01, I just wanted to say one more time that we'll be offering participation letters for this session. In about 24 hours, you're going to get an email with a link to an evaluation. And so once you finish that evaluation, tell us what you thought of the webinar. And also tell us what you think about the webinar concept. Then you're going to get your letter of participation. So right off the bat, I'm going to just talk a little bit about the logistics. So I know all of us have probably been on Zoom 500 times over the last couple of months, but you should see a floating menu bar. This is weird for me because this is the first time I'm not seeing myself, but I know my video is running, but I can't see what I look like. Anywho, so you're going to see a floating menu bar probably either at the top of your screen. I have a Mac, so I see it at the top, but it also could be at the bottom of the screen. You probably will see a mute or a unmute button, a video button. Then you'll see the number of participants. You'll see Q&A. You'll see the chat box on the far right. Now, there are a lot of folks on the call today. We have Honolulu in the house. That's awesome. And Louisiana. So one of the things that I'm going to apologize for in advance, we're now up to 321 people on the call, is that I'm probably not going to be able to keep up with the chat box. So I will check into the chat box as we're going through the session because I absolutely want to hear from folks. But I also want to just apologize in advance if you make a comment and I miss it. One of the things that we're seeing with these big turnouts for the webinars is that that's one of the challenges is keeping up with all of the comments. But having said that, I'm going to do my absolute best to keep up with the comments. So one other housekeeping issue is that here in Wisconsin, where I live, in addition to 2 teenagers, I have 4 dogs and 4 cats. And while I've strategically stashed the animal crew away in different rooms, I apologize in advance if I have a cat or a dog bark or sit on my shoulder during the session. I guess that's just one of the downsides, and they just barked. The mailman coming is the biggest part of our day. So just if you hear dog barks or cat meows, I apologize. So, you know, with these live stream trainings, and especially these really big live stream trainings, the goal still is to keep everybody engaged. And again, I just said, I'll do my best to monitor the chat box. And I'll give you my email address at the end of the session as well. But I just also wanted to give it to you now at the very beginning of the session. If you want more specific information about anything that we talk about today, or if you want to share some really cool things that you're doing in your community, please email me. The easiest email for me to remember is cheneymom@gmail.com. And so again, I'll give it to you at the end of the session as well. But if we get lost in the chat and we don't have enough time, send me an email. So So our objectives for the session today is, at the end of the session, I want us to be able to talk about how local conditions have changed with COVID-19. And boy, have they ever changed. I want to also talk about how coalitions are responding with key messages relevant to communities and families. And I want to really spend some time sharing what other coalitions are implementing in response to COVID-19. And then we're going to allow 30 minutes or as much as possible time that we have for discussion. So those are our learning objectives. So why this session is important. So one of the things that I've seen since the pandemic really came on strong is that coalitions are really looking for ways to stay engaged. And we're all trying to be responsive to the way that COVID is changing the landscape. And how do we keep the work moving forward? What do we do now with this new, completely new dynamic, this new monster that we have? And in-kind match, wow, has that been an issue for some coalitions, is how are we going to keep meeting the in-kind match when we don't have mileage now of people going to meetings, we're not meeting, we're not using our rental space. So I really want to frame this session as a learning and sharing community. I have learned so much from coalitions since we started this COVID reality, and I'm learning more and more every day. So what I've been doing during COVID-19 is I connect with coalitions all across the country. I've been with CADCA for about 7 years, and I have worked with or in most states, with the exception of Hawaii, still waiting to get the opportunity to go there. And so I've really been reaching out to coalitions, and the coalitions that I've got really good relationships with and that I've worked with, to see how they're handling this new reality and tackling the challenges and the key messages. And there's been a couple of things that have really stood out to me, is that once again, I've seen that community coalitions continue to be agents of change and are innovators to improve communities. Like, we are really, and I'm going to put myself in that, but it's really you. Coalitions are really stepping up to the challenge, and they're really innovative, and they're responding to the key messages and the issues that are so important now. And so I have continued to learn from coalitions. I'm going to be sharing today some of the strategies that coalitions have implemented in different parts of the country, but I'm excited to continue this discussion with you today. So even though we've got a lot of folks on the call, I'm going to be monitoring the chat box, and I really want to hear from you. So this is really an opportunity for us to discuss and share. So one of the things that I mentioned is I've been supporting coalitions and trying to figure out what this new reality looks like. And even though we're starting to see states open up again, things are not back to normal. And so one of the things that we've had to really figure out how to navigate is our new virtual community. And we need to stay connected in order to get the work done. And a lot of coalitions have come up with some really great ways to stay connected. But there's many options that coalitions are using. And one of the things that actually, Monib and I were talking as we were waiting for the session to start, and I was saying, we've learned so much about how to connect virtually that I think a lot of this, or certainly some key elements, are going to last beyond COVID-19. And so there's many free options, and many platforms have paid versions as well. And there's so much that we can accomplish virtually. I used to just do conference calls or sit and get webinars, but I've never done work planning and strategic documents and shared. There's so much that coalitions can continue to do together collaboratively using the technology that exists. And so I just wanted to spend just a quick second talking about those different options. And again, at this point in the pandemic, I know most of us have come up with or used most of these, but we've got Google Hangout. I really like Google Hangout for the options of being able to collaborate. Zoom is far and away the platform that I've been using the most, and that I've seen other folks use the most. Microsoft Teams is also really popular. And then GoToMeeting and WebEx, and there's usually paid or free versions of those platforms. And I really wanted to kick off our discussion today talking about this just briefly, because again, I don't think that we're going to stop having virtual meetings after COVID-19. And we don't even know what after COVID-19 looks like or when that is, frankly. So one of the things that I'm learning along the way is in order for us to keep the work moving forward, we need to be sort of firing on all cylinders on how we're going to connect virtually. I wanted to highlight freeconferencecall.com because I still use that a lot. And it does have a video conference capability, but for coalitions that are, have limited budgets, it offers free conference calling. And it's funny, I've had a few meetings recently where people are like, oh my God, I'm zoomed out. Can we just talk on the phone? And so I think that we need to be cognizant of the fact that people get tired of potentially being on GoToMeeting all day long or on Zoom all day long. So I just wanted to highlight some of those free platforms. The other thing that I'm learning is it takes a lot of work for us to keep people engaged. It's not just about what I'm doing today, putting slides on a platform, but how do we do polls and breakout groups? And Zoom is really, really good for that. And there's a lot of different platforms and software out there and websites that allow us to do that. And again, before we talk about moving the work forward, I just wanted to touch on that particular piece. And one of the things that you'll hear if you go to any CADCA training is that we have to be organized. We have to be professional and we have to be organized to get the work done. And I really feel now that the virtual reality that we find ourselves in is we need to be organized and strategic about selecting how we're going to meet with people virtually. And so just some tips for selecting a platform. And again, I'm not going to spend a lot of time on it, but I just wanted to put this on your radar if it wasn't already, is what is your budget? Now, some coalitions have funding, and so that's not going to be a problem. And the platforms like Zoom are not cost prohibitive. But what is your budget? I know that in some states, like university extensions are a great partner to have at the table, because in some states that I've worked with, they'll take over and provide the platform and run the meetings if they're part of the coalition. So do we have a coalition member or partner that that has the platform that they would be willing to let us use? What are you trying to accomplish? We don't always need to be connected via video if a phone call will do. And, are we trying to work on shared documents? The technology level of participants, I've really seen this really loud and clear. There are some people who are really stepping up and love this technology, and there's some folks that do not feel comfortable and don't want to learn the platforms. And so we need to be comfortable and provide options for folks to stay involved. Internet and computer availability, especially in some of the rural areas of the country, internet is slow now. And so some folks don't even have the connectivity to use some of these platforms, all things to take into account. And again, do we need to see each other? Will a conference call work? So when we're talking about sort of being organized to keep the work moving forward, I'm sharing this because if you don't have written guidelines for planning and for running online meetings, again, knowing that this may last post-COVID-19, I would suggest spending some time as a coalition, framing out some structure around how you're going to meet online. Just like when we're in the classroom and we're talking about making sure that we have action-oriented agendas and we give people roles and we don't just spend time sharing, that we move into action. Now that we're in the virtual reality, our new condition is telling us we need to have a different way of being effective. And so some of the tips that I've found really helpful is choose the technology that's most accessible and user-friendly for your coalition members. Ensure there's options for both online and phone-in. And as a CADCA trainer, we've always done this, but always make sure if you can to send, excuse me, a PDF of any slides or documents, excuse me, prior to the meeting. This is a big one. Ask participants to test the technology prior to the meeting. I don't know about you, but I've been on about 462 meetings that the first 20 minutes we're trying to figure out how to get on, what's the audio, oh, I don't think that call-in number works, do we have everybody's email address, we'll send you a new login, right? Like, so if we can get folks, if we can say, you know what, when we have our meetings, we're gonna have everyone test the technology prior to the meeting, that's your homework. And make sure that as a facilitator, whoever's running the meeting, that you're online at least 20 minutes. I said 20, but as a general rule, I'm on 30 minutes early, just so everything's loaded. I make sure the slides are on, and then I put myself on mute check my email or get ready for the meeting and wait till everyone joins. And again, this feels really logical, but if you don't have it written down and set as an expectation, this is an opportunity for us to sort of build capacity of our coalitions to be effective online. This I would share with your coalitions. And again, these are just my thinking. You may have better ideas than mine, in which case share, because we want to spread the wealth. But I've found it really helpful in asking people not to multitask. And I also find when possible, it's great to ask folks to use cameras because it's much more difficult for them to put the pot roast in the oven when they're on camera than if it's just a phone call and they can put us on mute. Make sure that you follow an organized agenda and allocate time for people to get involved. And let me say, one of the things that I've learned over the last few months in being in virtual meetings is breakout rooms, especially Zoom is great for that, as I mentioned a few minutes ago. Give people more time than you think you need to give them for those breakouts, because there's the lag time of getting into that breakout, figuring out what the discussion is, and we want to make sure that we give people enough time. And so following an agenda and allocating appropriate time is so important. One of the things I've also seen is people sometimes feel uncomfortable talking or unmuting, or they don't want to sound stupid or whatever, all of those things that go through our minds. So if you want people to participate, send the discussion questions prior to the meeting so that they're prepared to participate. And again, we don't want to do a gotcha or catch anybody off guard. Monitor both the chat box and the phone lines as you can. And I'm not doing that as well as I could be, but I'm alone today. So I just took a peek at the chat box. And then the other thing that I find is really helpful when you're on virtual meetings is assign roles. Have someone monitoring the chat box, have a timekeeper, a note keeper, a tech point person. One person cannot do it all. In fact, on the CADCA side of things, where we would have one trainer doing a training, when we're doing it virtually, we now have a CADCA staff, we have technology. So it's really a team-based environment. And so it's the same with you in running coalition meetings or planning meetings or work group meetings, is one person can't do it all. In this new virtual environment, we have to be structured so that we can be effective. So I just want to check in now. Now I'm going to look at the chat box. What form of technology are you using as a coalition, and what are you doing to stay connected? Welcome to hear from anybody. Zoom, Kim Linkle. Yeah, everyone's using Zoom. Yeah, it's amazing how many people are using Zoom. Facebook, love that. Uber conference, I've only used that once. Schools are using Google Hangout, yep. Phone calls too, I love that. So yeah, a lot of folks are using Zoom. It's amazing. Twitter, Instagram, WhatsApp. On my international side of things, we use WhatsApp all the time, Skype. That's awesome. That's great. Well, let me just also ask, has anybody developed any sort of meeting guidelines to keep them organized or on track as they are now meeting virtually? And I'm watching the chat box. Using an agenda. Jennifer, good. Zoom and Canvas, so that's just our agenda. So I really wanted to, had our youth group establish virtual meeting norms. Okay, Jace, that is the best comment of the day. You just won the webinar. Jace comment said their youth group establish virtual meeting norms. I love that. You did. You won webinar Wednesday. That's fantastic. And really the idea here is, I've just lost my mouse, is I really do recommend that if you have not, and I'm glad you're using agendas, but I don't think this virtual reality is going away. And just like we want you to have good, well-structured agendas, we want to make sure that you are firing on all cylinders and people are not dreading yet another Zoom meeting with, I'm going to pick on you, Kim Linkle, because it takes 20 minutes for us to get the technology working and to figure out the breakout rooms. So I'm going to move on now. I see the chat box. I'll come back to the chat box in just a few minutes. So I wanted to touch on that before we talk about moving forward with COVID-19. Now, let me just also say, one of the things that I have learned in absolutely every session that I've done with coalitions since COVID-19 became a thing is people want to share. They want strategies, they want to network, I think we want to feel together. I really feel like we want to feel like we're in this together. And so that's what I really hope to accomplish today. Is this is not necessarily new. This is really not new content. This is networking. And one of the things that has been at top of mind for people is how do we keep the work moving forward during COVID-19? And so, gosh, probably a month ago or more, I put some comments out on the CADCA community, and I'm a member of many Facebook pages for academies that I've taught. So I just put the word out. Tell me what you're doing. Share some of your strategies. What are the local conditions that you're seeing? And what are you doing? How are you being responsive? And so I'm going to share some of the ways that coalitions are moving forward. You may and probably do have even better ideas, but that's why I want to hear from you. But I also want to share just some of the ways that folks are doing it. And I don't want us to forget the spiff. One of the things that does concern me about COVID-19 is we can be responsive, but I don't want us to lose the process. I want to make sure that we're gathering baseline data. That may be qualitative. I want to make sure that if we can readapt our logic model and put the local condition as something that's COVID-19 related, that we do. And I don't want to get into that level of detail today. We don't have time, but I don't want us to forget the credibility of the process, so that, because we're going to have to evaluate, even if it's just process measures, the impact of the work that we're doing. And so I want to just make sure that as we're moving forward, we're cognizant of the strategic prevention framework. So I'm going to just sort of approach this from the steps of the assessment. And some of the things that I've learned coalitions are doing over the last period of time related to assessment is there is so much. We've transferred the work and we haven't stopped the work necessarily. I'm working, a lot of folks have done online focus groups, online key informant interviews. Some coalitions that I've worked with have done online community surveys. And I had one coalition, I can't remember. If you're on the line, shout out to me in the chat box. One coalition that I was interacting with has done an environmental scan by car. So they wanted to look at the new alcohol environment and what was happening. So they gave their coalition members homework of doing an environmental scan by car, which I think is amazing. So the assessment activities, if we're looking at what the new local conditions are, let me add to that an online scanning, environmental scan of alcohol advertising, or what is being advertised on Facebook. What are those new local conditions that are happening because of COVID-19? Get some baseline data. Do some assessment. Assign your coalition members to search the web to see what the local bars, I'm brainstorming here, are advertising for drink specials. The assessment activities continue. I'm going to stop now and look at the, I know. So Kristen just said, I love the environmental scan by car. I squealed with delight when I heard that. Like, yay, like that's so cool. There's so many cool things that coalitions are doing. This is just an example of a coalition in New Mexico that actually they transferred their coalition survey to an electronic one, and then got some local newspaper coverage so that they could look at this, Luna County Coalition Against Teen Substances Needs Your Help. Love it. So that work doesn't necessarily need to stop. I also want to spend a little bit of time, so that's on assessment, and we're going to come back to the assessment and how we can measure what's happening in our community when we get into looking at what those local conditions are. And I'm going to hone in on two specific local conditions for the purpose of our chat today. But moving the work forward in capacity has been a really important piece for coalitions who are looking to figure out what can we do when we're not meeting and we can't do our town hall meeting, or how do we get in-kind hours from coalition members. There's a whole lot of capacity building that can be done. And, you know, at mid-year, a few years ago, I used to do this capacity building training, and people would say, they'd come in and they're like, Dorothy, these tools are so cool, are so great. You know, these are great tools. And I'm like, well, if you went through the National Coalition Academy, you saw all these tools. But my mentor and trainer, who's always sitting on my shoulder, Dave Chevelle, always says, you need them when you need them. So if you've gone through the Coalition Academy, or if you've been to any coalition trainings, or if you're a member of CADCA and you want assistance, that's be a great call to any of the coalition development team. Is CADCA has volumes of tools and suggestions to help you build capacity as your coalition. And this is a fantastic time to do an electronic coalition member survey. We always recommend that you do an annual survey anyway. I've worked with coalitions that have been revising their bylaws or developing job descriptions. One coalition that I'm working with has done member orientation packets, and they did a table of contents on the workstation. If you're a graduate of the National Coalition Academy and still have access to the workstation, in the capacity building tools, there is a table of contents for a member orientation packet. So they developed a table of contents and then assigned different elements. So the overview of the strategic prevention framework, Sally's going to do that. The organizational chart, John's going to put that into so it became a collaborative packet. So going back to, Google Docs or Microsoft Teams, using those platforms to actually get some of these projects done. This is also a great time for coalition member development. There's been a lot of folks that have reached out to me saying, what are we going to do for in-kind hours? Where, all of this is in-kind hours. There's so many ways that you can find in-kind hours for coalition members. And there's so many virtual webinars that are out there now. So many online learning communities exist. Ask your coalition members to do an online course and report out, or just share at the next meeting or at your work group meeting, whatever that looks like. I also want to put a shout out for, if you've got new coalition members, I love the online learning online at CADCA. It is being revamped. So there's going to be more opportunities and refined opportunities. But my favorite online training is the Core Essentials. You do not have to be a member of CADCA, and any one of your coalition members can take the Core Essentials course. That would be in-kind hours that can go to match for DFC, and you're building the professional development of your coalition. So there are so many activities right now that you can be engaged in to build capacity. And, who's got time to revise the bylaws? Or, those are those things that are always sort of hanging out there as like, oh yeah, we need to revise the bylaws. We haven't updated our community assessment in 2 years. Now is the time to divide and conquer, to engage your coalitions, and to use technology to give them the tools that they need so that we can get some of these capacity building activities done. So this is the new reality, and there's so many ways that we can continue to move the work forward in this new environment. I've just scratched the surface, but checking in. Now I'm going to look at the chat box. What assessment and capacity activities are you folks working on now, or could you work on now? And I'm going to bring up the chat box. Gail says, we're just getting started. Ideas for how we can begin to recruit, engage youth for the work of the coalition. That's a great idea. And we're going to be talking a little bit about some projects that youth are working on. And I'm going to also put a shout out to the community forum on CADCA again a little bit later. But oh my goodness, there are so many rich ideas that are being shared. So get on that CADCA community forum, ask questions, share ideas. Kristen, you're doing student and parent surveys. Athens, Georgia has sent letters to all 248 licensed alcohol vendors offering to-go delivery services to check IDs. Love that. We're going to be talking about that strategy in just a few minutes. Putting out community surveys and sending materials home and school lunches. We've seen a lot of coalitions doing that. That's amazing. Training of new members. So the work is shifting, but there's still great work that can be done. Let me just remind you of those amazing tools if you have access to the workstation. If you don't, just contact CADCA. We can get you those tools. There's so many great tools out there. Lane, you said you'd love to obtain a member orientation packet. Absolutely. ChaneyMom@gmail.com after the session, or you can connect with Monib at CADCA and we'll get those tools to you. There's so many things. So if you want to train new members, invite them, incentivize them to do that Core Essentials training online with CADCA. It's amazing. It's like spending a couple of days at the academy. So sending education and welcome bags. So some really good strategies. So you guys are really keeping the work forward, moving forward. I always lose my mouse when I go to the chat box. So those are assessment and capacity building activities that I wanted to touch on. And again, there are so many good ideas out there of folks that are keeping the work moving forward. And I'm just highlighting a few of them because I'm hoping that you'll get one or two takeaways from this session. I always say when I'm doing trainings, especially at mid-year, we got big people, big groups of people, not big people. You know, I want folks to at least get one or two takeaways from my sessions. And so that's my goal today. Is there are one or two little nuggets you're going to say, oh, that was when Dorothy shared what the coalition in Connecticut did, blah, blah, blah. That's a really good idea. Or maybe I'm now going to go ask the question on the coalition community forum at CADCA, you know, what is someone doing about blah. So, so that's really what I hope to accomplish today. I'm going to take one more peek at the chat box and then I'm going to move on. Can we receive a copy of this chat box content? I know it up, Cad, because I had a Monib is monitoring the chat box for me, so he's responding to that. So you will. And once again, I lose my mouse for a minute. Okay. Okay. So next, and this is where I really want to spend some time. Planning and implementation. So if we're moving through the strategic prevention framework, we talked about, we still need to gather data, even if it's an environmental scan by car. How cool is that? There's all sorts of capacity building work that can be done. All sorts of capacity building work that can be done. And then we need to move into planning and implementation. And that's where we really start looking at the new local conditions. And there's two local conditions that seem to be universal in our country right now. They look different locally, right? Because anyone that's gone through the academy knows that all substance abuse is local, but there's some general trends that we're seeing. And one that's so different now in this new environment is retail availability. This retail alcohol environment that we are now in is just like something we've never seen. And we're seeing curbside liquor delivery. We're seeing folks selling alcohol in styrofoam cups. And one of the local restaurants in my community, like it's legal for them to sell to go, but it needs to be sealed. In one of the restaurants in my community, they're selling big double margaritas in styrofoam cups with a straw in it. So like you're literally able to sip it as you're leaving the restaurant and driving home. We've got this crazy alcohol environment now. And so we've got all these challenges. We can't meet in person. We can't, you know, we need to social distance. And look at what's happening with the retail alcohol environment. We've got this code red going on in so many communities, but we've got these challenges. And I see that there's some folks in the chat box. I'm just going to take a quick look at the so increased availability of curbside marijuana as well. I'm not talking about that today because we don't have time, but I know. And you know, one of the other things is so interesting is how are alcohol and marijuana, and there's, from a public health standpoint, we know why they're considered to be essential services, but what is that community norm that needs to be, you know, combated when we consider alcohol and marijuana to be essential services? Certainly with alcohol and the physiological impact of withdrawal, if folks can't, you know, have an advanced alcohol use disorder, but I'll just leave that there. Essential services. So we're seeing this crazy alcohol environment, and coalitions are responding in every corner of the country. So as you're looking at this, I don't want you to forget the fact, two things. You need to get some baseline data, find some baseline data. If you don't have drug-free funding, you still want to follow a good process. You still want to be able to have some baseline data. And if you are a drug-free grantee, you're going to want to be evaluating your work. My dogs are playing. I apologize. So you want to make sure that you get some baseline data. The data may look different. That's okay. There's no such thing as perfect data, but we want to make sure that we have data. So first of all, what are your community's current state alcohol laws? So we should all have a pretty good baseline. If you don't have a good baseline of what your community or state alcohol laws are, this is a great thing for you to assign to one of your coalition members, is to find out what the alcohol laws are. So depending on whether or not you've got local control or an ABC, an alcohol beverage control at the state level, that will impact how your community's alcohol laws look. What has been adapted or changed with the pandemic? And this is really important because in a lot of states, it's still not legal to sell open containers of alcohol but retailers are not necessarily in compliance with the way that the laws have been adapted. How many restaurants, here's some good local data, how many restaurants or bars are selling curbside? So how are you going to assess that? Love the environmental scan. Assign your coalition members, areas. One of the things that I would also maybe do, I've done this for other projects that I worked on, not COVID related, but I know that in my community, there's a lot of encouragement to do takeout to support local restaurants and businesses. So if your coalition members are going out to pick up food, give them a little checklist of, is alcohol sales happening at Joe's Diner? Are they selling mixed drinks? Do they be checking IDs? Do they be checking IDs? Are they checking IDs? That's really good data. So you can then have your coalition send that information to you. You've got that baseline data. Why is it important to get baseline data? Because we want to know after COVID-19, what has changed, right? So don't lose the process now. There's certainly ways to get this. How many bars are selling mixed drinks to go? How many are asking for ID? And how we respond now is going to be really important to what we do after COVID-19, whenever that is, right? And so another way to do this is to do scans online. Look at Facebook posts. I know that the local Chamber of Commerce, for example, in my town, and I haven't been on a plane in months now, so I'm talking a lot about Wisconsin. The local Chamber of Commerce has like daily posts for restaurants and specials. And what I'm seeing, like I'm in Wisconsin, so it's all about cheese curds. I saw yesterday a bar was saying, if you buy whatever X number of takeaway drinks, you get 2 orders of free cheese curds, which, it's a huge incentive if you live in Cheeseville like I do. So all of that, scanning the environment to see what this new alcohol environment looks like. So don't just jump into strategies, make sure that you're actually gauging what's happening in your community. Now I'm going to take a little pause at how can we assess if they're checking for IDs? So that's a really good question. What I would do is if your coalition members are going out and getting takeout, like I know I go out and get takeout probably twice a week now, give them a little checklist, like a little quick checklist of looking at, and they don't have to take it with them and like check it as they're going. 3 questions. Are they, whatever those questions are the bars selling mixed drinks? Do they seem to be in compliance with the alcohol laws? I'm brainstorming here. Did they ask for an ID? Are they checking IDs? So that's a scan, that's scanned. So that would be one way to start. Now, is that going to be perfect data? No, but if all your coalition members say, we went into Joe's Diner and gosh, they're selling alcohol hand over fist and not once did any coalition member get asked for ID, that's a pretty good indicator that they're probably not asking for ID, right? So, what is an environmental scan by car? Jennifer asked. Well, didn't know until COVID-19. I'm going to call it the COVID-19 scan by car. They were looking at, so this particular coalition, if I recall, they were looking for a couple of things. They were looking for what the new environment is. So they drove by retailers to see if there was curbside delivery, what was happening related to alcohol and the retail environment. And they were also looking at like the common areas, like here in Marshfield, the skate park or the roller rink to see if kids were gathering or if they were respecting social distancing. So they were assigning their coalition to really get a lay of the land in light of the new conditions with COVID-19. I thought it was so innovative. I've lost my mouse for a second and then I'll get it back and get out of the chat box. So, and if anybody wants any of these resources, again, email me, chaneymom@gmail.com, or connect with Manib or any of the coalition development team and we'll get you anything. So I wanted to share just a couple of really cool strategies. And Georgia, you said that Athens, Georgia is doing one that I'll mention in another. So one of the coalitions in Connecticut, what they did was they had ID scanners. And so they actually provided them to some of their local retailers so that they could actually do scans with curbside sales. So I love this. I love this because they collected data to see that there's curbside sales. They see that they've got these scanners that aren't being used because the bars aren't open. And so they partnered with, let's provide you with a resource to help you stay in compliance with alcohol laws so that the curbside sales, they would still have an opportunity to do the scanning. Now, that's, they still want, we would still want to have, a mandatory ID policy, but what a great way to partner with retailers so that you can support them in, maintaining their business, but also adhering to the law. Post dates and Grubhub check IDs when you order delivery. That's fantastic. I didn't even know that Grubhub ordered, or you could even order alcohol with Grubhub. I live in a small town. We don't have Grubhub. Yeah, can you get a copy of the environmental scan questions and data points? Sure. Pam, training at CADCA.org is right there. And we'll work up some sample questions because, we've got other environmental scans, so we just need to transfer them over to the cars. Absolutely. Yeah, sure. Hey, I am here to provide ideas for you guys. So anything you need, we'll figure it out. Training at CADCA.org. I want their inbox to be full after this. So this is an example. So Athens, Georgia, if you would like to share your letter, that would be great. I posted this to the CADCA community. I really like this one. So this one is a letter that the coalition partnered with the police chief, proactively saying, and this is a Wisconsin example, and I've got a few Wisconsin examples, but trust me, I have coalitions from all over the country, so I'm not highlighting just Wisconsin. It's just, there were examples that I have, but there's so many out there. But I love this because they reminded the bar owners of the laws. And I mean, it's a nice letter, but it also is saying, you know what, we expect you to adhere to alcohol laws. So I really love these kinds of messages. So the new alcohol environment, let's be proactive. And if anybody wants a copy of this letter, I've shared it a lot. And Athens, Georgia, if you want to share yours, we would love that. Grubhub and Uber Eats are probably not checking IDs. Yes, they're probably, okay. I hadn't heard of that. So huge deal. I mean, access to alcohol now and then coupled with the stress. I've got a 14-year-old and I've got a 15-and-a-half-year-old, and they are trying to do AP exams and deal with the loss of the school year. My kids are under lock and key, trust me, but there's a lot of kids that are really, really stressed right now. So the temptation for high-risk behaviors coupled with increased access, wow, again, we're in the red zone now, aren't we? Like, we are in code red. So before we go into the extreme alcohol culture, holy mother, I just want to check the chat box on the retail alcohol culture. Tracy, you just wait. So you send a letter to all graduating seniors, provide portable ID scanners. Teresa, of course, in Wisconsin. I've seen the ID scanners, but they're not only checking IDs, so the scan isn't going to help. Yeah. Tanya, hi, Tanya. You're going to send it to us. That's perfect. All right. Okay. So, all right, let me just ask quick on this one. How many people saw the SNL skit last night or last Saturday night? Yep. Yeah. Yeah, I know, right? I know. Yep. Okay. Yeah, I know. But when I talked about local conditions, right? New local conditions, talk about an extreme alcohol culture. And I had it written down yesterday, I was doing a virtual conference in North Dakota. And we were talking, because all of the sessions that I've been doing lately, they turn into share shops of what we're seeing in our community, because that's what we need right now. We need to be like, we're connected, we're all in this together. And one of the public health folks said, this isn't a new problem. And of course we know that. It's accentuating the problem that we always knew existed. And boy, does that describe the new local condition of the extreme alcohol culture. It defies description what we're seeing now with the extreme alcohol culture. And I'm sure in states where there's legalized marijuana, it's absolutely the same with marijuana. Didn't make it well, it kind of was mentioned in that SNL skit. So we have got this crazy new extreme alcohol culture, and online sales, look at this, jumped 243% during the pandemic. And this one, look at this. So this did not arrive in my Facebook feed, but it did arrive in somebody's Facebook feed. And I had just talked about the alcohol culture on a webinar, and someone said, Dorothy, look at this. Look at that Barbie. Like, I'm sure it's a mocked up graphic, but like we celebrate the whole wine o'clock. We've got this crazy culture. And so when I want to talk about staying engaged during COVID-19, I was like, holy God, I'm talking about the alcohol culture. What did SNL just do? Like, what did Saturday Night Live just do? And again, the alcohol culture is not new, but oh my gosh, I don't even know what to say with that. Gosh, I've been in this field close to 30 years, man. This one blew me away. And the thing is, can I just tell you, it's a catchy tune. I'm finding it in my head like an earworm because the dang thing is catchy, and which makes it even worse. It's unbelievable. And I know, I see there's a lot of folks that hadn't saw it, so I wanted to share it. You can Google it on YouTube. And I want to then talk about the fact that there are strategies and counter messages. And that's really sort of the last piece that I want to talk about is that, and anyone who's gone to any CADCA trainings, certainly anybody who's gone through any training with me, knows that I want you to get to policy, systems, and environmental change. It's not just about education and awareness, right? But I'm giving us a little soft side on that because there's so many key messages that need to get out, and they need to get out fast, and they need to get out in a lot of different ways. And so I'm going to go through this a little bit quickly because I want us to have some time to talk. If you do not participate in the CADCA community, I'm begging you to participate in the CADCA community. I'm begging you to do it because do you know how much I'm learning about what coalitions are doing and coalitions share? And it's just a treasure trove of support. Coalition development team is there. And even if you don't want the support of the CADCA trainers or coalition development, can't imagine why you wouldn't, but nonetheless, there's amazing things that are happening with coalitions and they're sharing. I get an email when there's new chats, and I spend an hour a day on this reading what coalitions are doing. So there are so many good resources that are coming from here. So when we're talking about working together, and remember, I'm in Marshfield, Wisconsin, a population of 14,000, I think. I don't remember, dear God. It's small. And if I send an email to Lorne Michaels at Saturday Night Live, what do you think he cares that there's Dorothy Chaney from Marshfield, Wisconsin? But you know what? When Tanya Knox from Athens, Georgia, and Roseanne Grady from Florida, and Teresa Pellet from Stoughton, Wisconsin, and 500 other coalitions contact Lorne Michaels, then our voice begins to be heard. And so in COVID-19 with these messages, we don't have the budget, we don't have the commercial sponsors, but we have the grassroots power. And I came from Mothers Against Drunk Driving. And if there's one thing that I know is the power of grassroots to make a change. So please connect, stay connected, share these messages, copy and paste emails. If you write a better email, share it with us because that's how we counter these messages, people. You know this. You are the ones that are the agents of change in your community. So the coordinated response, and someone had just asked, this is the letter that was shared. So there's a template. It's on the CADCA community or training@cadca.org. So it is there. So this is a template, but there's so many other ways that you can respond. Look at your local elected officials if you've got good relationships with them, your mayor, your folks that are really thought leaders, and your coalition. Right. And this would warrant a Zoom meeting of your coalition, in my opinion. Even just do like a 30-minute meeting with your coalition to say, man, we've got some real strong messages. How do we get the counter messages out there? Because that's how we start to count it. We're not going to have the budget. Your letter was sent out yesterday. Okay, good. So we're in this together, people. So these resources. So I'm hoping that if you haven't written a letter, if you did, thank you. Share it if it's even stronger, or you've got different ideas that you want to express. And if you haven't, this would be one takeaway. I'm pleading every coalition to share that video with their coalition members in an appropriate way, probably not to youth. Like, it makes me sick to see those anyway, all of that. So I also just wanted to talk about part of our messaging needs to be directly to Saturday Night Live. There's no question. But this is also a really good time to be innovative in updating research and information on Twitter, on Snapchat, on Facebook, if you're looking for the 50-something-year-old women like me. So there's a lot of really good resources out there. And so there's also some really key messages that we need to get out there related to increased use of substances and increased risks for COVID-19. And the more that research comes out, the more messages are even more clear. But I just wanted to share, that's, if you're not doing it now, partner with your local school district and put some resources on their website. I'm brainstorming. Use your coalition partners so that you can get and expand some of these messages to folks. I love the idea, and there's quite a few coalitions that are doing it, are putting materials in lunches for the free and reduced lunch that's being picked up. Look at that. Are there any resources that we can obtain that we can also disseminate that way? Another thing that we're seeing a lot of coalitions to do is coordination and communication. So, I mean, we're in a virtual reality now. So how can we share healthy alternatives, self-care? God, I got a kid with anxiety and she's had migraines now for like 3 weeks. And so, you know, there's so much going on right now that's increasing risk of substance use, not just for the youth, but for the parents. We're looking at unemployment. We're looking at businesses that are in decline. We're looking at mortgages that aren't being paid. So we have this code red of risk factors. And so part of our work needs to be also connecting so that we're providing the right resources and the right connections to people. A couple of just really fun ones that, not fun, just helpful ones that I like. I really love the Parents League, parentslead.org materials. There were also, there's just a lot of materials out there, but here's some resources and references. These came out from, if anybody wants these, I've been sharing them. A coalition in Rhode Island shared them with me. I love these. These are just, they were posted on social media. They were sent out via email, I think. And they're just really, really great way of saying during COVID-19, underage drinking is still a problem. I think I also posted these on the community. If you've got something to share or you are interested in these, training at CADCA.org. But just some ideas of how to get some messages out there. And I really liked these. They really spoke to me. In Fargo, North Dakota, the public health unit there is doing amazing counter messaging. And they're putting out on all sorts of social media education related to COVID-19 and substance use. So I just wanted to share that. There's some everyone is doing such amazing things on Twitter. Now, there are 453 people on the call. There may be 112 coalitions that are doing Twitter. Share your posts, because I guarantee you people are like, what am I going to post today? Or where are we going to share your posts? We're all in this together, people. And there's some really good messaging that's out there. And this is low cost or no cost. So we don't have a lot of time to check in because I want to get through the last examples, but I'm going to go, the skit is advocating child endangerment. It really is. Is there a template to send out to high school students with a message about not drinking during this time? Rebecca, I'm going to go out on a limb and say, I bet you there is, or we could find one. Or Monib, I know that you're on the line. We could post that to the community forum and see if anybody has a letter that they sent out to high school students with a message about not drinking during this time. Anyone that's on the call, if you've written out such a letter too, if you would share it, that would be great. The coalition I work with is talking about doing sticker shock and putting stickers on alcohol and food products being delivered in their community. I love that. I love that. Yes, yes. Healthy behaviors shown by youth on social media platforms are quite effective. Yeah, this is really, code red, last time I say it, I promise. This is time for some really innovative counter messaging. That's what this is time for, right? Because counter messaging using technology, it's really pandemic proof. And people are online now. So my last bit, and then we're going to go to some questions and answers, is I wanted to just show some innovative ways of using technology. Again, I've established these are just ideas that I've come across. Plus, I've got bazillions more because coalitions are doing amazing things right now. Amazing. And we share. So I just wanted to share, while the COVID specific messaging is important, we also want to make sure that if we're dealing with vape or we're dealing with prescription drug misuse, that we're also framing those messages in a way that are important now too. So, sorry, I'm gonna start to cough. So these are two examples from Wisconsin. And again, I didn't deliberately pick Wisconsin. They are just coalitions that I work with really closely. And I got permission from them quickly because I reached out to some other coalitions and didn't hear back. So not promoting Wisconsin over any other state. You all know that. But this group has been doing this for actually a little over a year, and they created podcasts. And so I just wanted to share that. And so I connected with Kathy Como, who is the director of that coalition, because they started this about way before COVID. And so they have a podcast called Clear Thinking. So I asked her about it. So the picture there is the vice chair of the coalition, and he's got all his equipment, and he's doing a podcast with his son there. So I asked the coalition about how they became engaged in doing podcasts, and it was really interesting how the idea came about. They had a dentist who did a lot of preparation to do, I don't know if it was a town hall meeting, but some sort of community presentation on how dentists are responding to the opioid epidemic. And this dentist was really excited about it and had all the materials ready. Okay, I know none of you can relate to this, but nobody showed up. Nobody showed up. And so the coalition thought, well, how are we going to disseminate these really interesting messages and important messages when we can't get people to go to meetings? So they wrote a grant to the local community foundation. So if you don't have grant funding, I'm sure you've got a community foundation, or you can find a corporate sponsor, or maybe an extension or a high school, whatever. They started with SoundCloud, which is free, but it also is a paid subscription, which they upgraded to. And they branded their podcasts Clear Thinking. And you can search for it on your phone's podcast app. I'm 52. I didn't even know my phone had a podcast app, but it does. And I found it, and I listened to some of their podcasts. But I wanted to share that because what a great way for us to be able to get some more in-depth messaging out at a low cost, using a low cost method, relatively low cost method in this time. So I'm going to look, I see some chats coming in. I'm going to look at this. So, all right, you have got one, nothing changes if we change nothing on Spotify. Provide TA. Oh, I love it. Okay. So I heard someone saying, I'm not a member of CADCA and not have access to the CADCA community. So email training@cadca.org and we will share as much as we possibly can get you your way. Can you tell me again, how do we get all the amazing resources being brought up on this webinar? Training@cadca.org, and we will share absolutely everything with you, and it'll be on the CADCA community too. So, and if you forget that, I lost the mouse again. Every time I go to the chat box, I lose the mouse. So just talk amongst yourselves. There it is. Okay. So, podcast. So if you are doing a podcast, let me also do a call to action. Post your link to your, whatever your, I know nothing about technology. Post your podcast name, that how we can find it so we can promote it. And like, we are in this together, people. So if you're doing a podcast, put it on the CADCA community, share it with training@cadca.org. We will highlight, we will learn from you, and we will highlight, and we will share, and we will promote your work, because I think this is an amazing, amazing initiative. This one I want to play.
Wait, what's in my vape?
So again, this one came from Wisconsin. There are so many cool things that are happening out there on social media. And I reached out to a couple of coalitions that because as trainers, we keep our eye on, our eye on what's going on in the field. And so I reached out to several coalitions, but I didn't necessarily hear back from ones that had YouTube ads or social media ads to share. So I did get permission from Wisconsin. So there's lots of them out there. I love this one. This YouTube ad, it also is played on Facebook, I believe. that's linked into their action plan. So they knew that they were addressing vape. And so as they were doing their annual planning, they were talking, okay, we've identified vaping as an issue. It's in our logic model. We're mapped into strategies. You know, we've got really good local conditions. Part of it is we need to get some key messages. And so they met with the youth, and the youth said, we want to meet where students are online. That video was shot with an iPhone. So it was very, very low budget. The message was actually written by the youth members, and they wanted to talk about the misconceptions held by youth. And again, it plays on YouTube and Facebook, and the coalition sets a daily budget. What I really love about this ad, and so I know a lot of coalitions are doing this, this is just sharing one resource, is that, so I don't do a lot of YouTube, but we know when you watch YouTube, you have to get an ad if you don't have the paid subscription. Well, they actually had it set by zip code, so that if teenagers are looking at, I don't know what they're looking at, what teenagers look at on, and I've got to, on YouTube, they would see that ad. So they are a captive audience having to see that ad. And we were getting some feedback from this group that teachers were seeing it too online. And so it was really targeted in that particular geography, which is really exciting. And it's a great way to engage youth and leverage the technology and create creativity skills of youth. Some of the sectors that were involved in this initiative were youth, schools, businesses, healthcare, public health, parents, and local government. And I love that this is a great way to get messages out, whatever the message is, right? Because even vaping, if we're still addressing vape, so there's additional messages with COVID-19, but it's still relevant to get these messages out, right? So these are almost pandemic proof. I'm going to go to the chat box. I can share the YouTube ad link. Yes. Our youth council made a vaping PSA that's very similar. Perfect. I want to see it. Okay. So perfect. So yes, I'm monitoring the chat box. So yeah. So ideas on how to get, oh, okay. Roxanne, you said, 334 Prevention Project Youth Council has a TV show called Teen Talk, also on Facebook. Okay, so we need to see that. Okay, we need to see that. And can we get a recording of this training? I think it is being recorded. That's a Manib, if you could respond to that in the chat box. I didn't lose the mouse this time. So I don't know if we've got time. No, I'm going to skip this one. This is another one that I really, really like. This is a YouTube video. It's just one girl talking, and she comes across vaping is so lit, and it's just a really good message. Love it, love it, love it. I'll also send the link in that. And again, like, this is great opportunity for us to really leverage technology and our youth and to engage them in doing some counter messaging, because boy, oh boy, do we need some strong counter messaging now. This also came from a coalition in Connecticut. Also love this. So if you don't have the knowledge or the resources or the engagement of youth or whatever it is you need to get those podcasts and videos done, there's still some really good sort of lower cost ways of doing this. I've been sharing this as well. And so again, any of these you could take I really like those talking points. You can format it any way you want. I see a few comments in the chat box. I'm just going to pop over. Can we share a recorded webinar with the community? You sure can. Okay. You can share this as wide and broad as you want, and I'll just pretend that I don't listen to myself online, because that would, anyway. This one came out of Bakersfield. I've done a lot of work with Kern County. I love what they're doing there. And so they are doing a lot of tweets, and they've got blogs, and I really loved this particular messaging. So again, sharing this message of vaping putting teenagers at greater risk of getting seriously ill with coronavirus. So a couple of other key important messages, and I really want to give us as much time as we can for dialogue, virtual dialogue. A couple of other ones that I collected along the way that I really like. I really like this one. This came from the Reach Coalition. keeping kids safe during this uncertain time. And again, this came out towards the beginning of the pandemic, but I think the messages are still really, really, really relevant. The one on the right, one of the many hats that I wear is here in Wisconsin. I coordinate the SPIF RX project that is funded in 2 counties in Wisconsin. And so we're doing, as part of the work, we're working on a state campaign that was developed by the state. We're implementing it, called Dose of Reality. And so we've been working on the prescription drug issue for a long time, and we leveraged that campaign and those graphics to change the message a little bit. And so we sent this out via email saying, while everyone's home, lock up drugs, talk about drugs. And so there also is a draft of an email message, and I'm happy to share it if anybody is interested, if you think that that would be a good message to target in your community. And the link in the hyperlink at the end of the email, learn how to lock up prescription meds now, had a link to drop boxes, but understanding that a lot of drop boxes are closed now. In those 2 counties, they had the capacity to have an email or phone or both for public health. And so if people wanted to dispose of medication because everybody's home and the take back isn't happening and the permanent drop box isn't open, then public health would send Terra bags to your home so that you could dispose of your medication safely while kids are at home. So if that is of interest to you, other resources that we will share, training at CADCA.org, all of this will be sent their way. And again, I'm asking if you're doing anything cooler than this, which I know a lot of you are, certainly please share them with us so that we can share them with other coalitions. I'm going to check the chat box. Okay, so I'm going to look at the Q&A. Oh, here's a really interesting comment. We need more non-tech ideas. Our community is urban with an extremely high poverty rate. Our families lack equipment and internet connections. So that's a really, really good. That's a really good point. And there are some suggestions out there, and certainly we need to do more. The lunchbox ideas. You could do a mail campaign if you've got funding about the prescription drugs. The sticker shock campaign, those are going to be all non-tech ideas. And certainly, Anita, that's a really good question. And I think that also in really rural communities, there's no connectivity. So I think that makes a really good chat. I'm going to post that on the CADCA community. And Anita, you can reach out to us at training@cadca.org. And we'll, if you don't have access to the CADCA community, and we'll share with you some other ideas. Great, great, great. Laura, you said, is DFC supporting our coalitions in making these kinds of pivots from our work plan? Do we need to get permissions? So you know that as a CADCA trainer, I don't represent drug-free. I represent doing the work, right? But I would always say that these pivots to your work plans need to go by DFC. Having said that, that's a really good conversation to have with the coalition development staff, because I know that DFC has done a few phone calls. And so there is the expectation that things are going to change. Again, that would be a really good directed question to training@cadca.org, because I know that they've got their finger on that pulse. Good questions. So thoughts about COVID-19 and beyond is, coalition work really is more important than ever, and we're all in it together. And my goal today was just to share how we are all in it together and that we're working together. I'm begging you as a CADCA trainer, whatever your strategies, link them to data. Qualitative data can be great. Environmental scans by car, have some kind of data. It doesn't have to be perfect data, but just have some way of knowing what the situation is before you do your interventions. And it may be process measures. So if you're going to do YouTube ads, how many views do you get? How many clicks do you get? And if you've got the budget to actually pay for some of that, you can get some really good analytics, low cost or no cost, from Facebook and some of those social media platforms. Our coalition may look different, but there's still a lot of work that can be done. And as we're sort of in this, we've sort of got a foot in both worlds right now, right? Like we've still got the pandemic that we're dealing with, but we're also preparing and moving into life after the pandemic, which may or may not go back to normal. And so we need to understand what the local conditions are now, but we also need to be prepared for what they're going to look like post-pandemic. And so, for example, those alcohol sales curbside, I want to have baseline in my community. So I know if I've got 14 bars in Marshfield, that 11 of them are selling curbside right now. When things go back to normal, I want to know how many of that 11 continue that practice. And lastly, if there's one thing that I've learned, I've never been more proud to be part of this coalition movement, that coalitions around the nation are rising to the new challenges, and we 100% are stronger together. We are absolutely stronger together. And we're going to get through this together. So do you have strategies to share? Email me or training@cadca.org. Share your great ideas on the forum. And we want to make sure that we leave at least 30 minutes for questions. We don't quite have that much time, but that's the end of my content. And let's move into the chat box, and I invite questions and discussion now. What is the link that I mentioned to the DFC webinar? Training@cadca.org. I don't know if they tape recorded that, but they offered it. I'm sure they did. Yes, unfortunately with COVID-19, there's a considerable rise in domestic violence and theft. Suicide contemplations are also up. You name it, right? Because we've got so many, just so much trauma that's happening. I just read in the news yesterday online that there was a child that had been locked in a warehouse and school closed. I mean, there's some really bad things that are happening in the community because we've got a lot of trauma. And so that when I go back, when I talked about earlier, you know, connecting with other organizations, we may not have, and I would argue we probably don't have the capacity to deal with all of the issues in the community, but you know that there are domestic violence agencies, and they're probably our partners at the table. So how can we connect and work together to try to advance everyone's key messages right now and to provide resources to the people that need them? We're not a member of CADCA yet. How can we get a sample copy of the letter to send in regards to this SNL skit? Training@cadca.org. And I look forward to you joining the CADCA community when you become a member. So I see the yet there. So Jody, we can send you that training@cadca.org, or Jody, you know me, you can send it to me too. With the current, that's a really good question. With the current COVID-19 pandemic, has CADCA decided to proceed with the upcoming mid-year training institute? What I can tell you, again, I'm a CADCA consultant. I have drunk the CADCA Kool-Aid and I am all CADCA, but I don't make the decisions. So I do know that CADCA is proceeding now with an in-person training, however, really watching this situation closely. So so stay tuned on that one. I know CADCA is a public health organization and isn't going to risk our public health. So I guess we're waiting to see what happens, but right now it's proceeding as an in-person training, but stay tuned for that one. I'm going to look up at the Q&A. So it's interesting. One is, what's a good method? So I'm going to come to the first one. What's a good method to conduct breakout sessions when you're conducting meetings, trainings virtually? Wow, have I done a lot of that lately. So I would say keep it simple. So the easiest way, the least stress way, is to have a very simple discussion with very clear instructions, and then just don't worry about pre-assigning. If you can, don't worry about pre-assigning breakouts, because that's where it gets kind of funky sometimes. I've tried to, and you definitely need to have more than one person. So I would say, and what I have done, in fact, I did it yesterday when I was working in North Dakota, I had really clear instructions on the slides, and then I had a discussion sheet. There was a Word document that I put in the chat box for everybody to download. And then the instructions were also listed on the instruction, like on the discussion sheet. And then everybody went to their breakout, they did their discussions, and we asked folks to take notes. And then as they were sharing from what they discussed, they were given the opportunity to share their screen so they could actually share the document that they had typed into. I've tried it a million ways, James, and that seemed to be the easiest way that I've accomplished it without like messing around with technology. And if that didn't answer your question, training@cadca.org. Our communities in South Africa have started to ferment their own homemade beer using pineapples and apples. Can you please advise? I can't advise. I wish I could advise on that. I think that there are some really strong messages. We've actually have some samples. I was going to show them. We've got some really cool messages from South Africa about high risk drinking. If you want to email training@cadca.org, we can send you some of those ads that we've seen from South Africa that we have used as samples of best practice. That's the best answer that I have. But it's just really, we can't stop what people are doing in their own homes, but we certainly can try to be proactive in counter messaging. Roseanne says, do you have any suggestions on how to host a town hall meeting virtually? I would say the easiest platform that I've seen, and I'm not the expert, but Zoom seems to be the one that is rising to the surface and has a really large capacity. And I've seen folks that have done, I've actually attended a Zoom funeral where we had folks from all around the world. So the sky's the limit really with using that technology. I think you could have your panel of speakers, they could have their presentations, and then you could facilitate the discussion afterwards. Zoom, I think, would really lend itself to doing that, Roseanne. Nice to see you virtually, my friend. So more resources are being shared. NAMI has put out a lot of great resources for suicide prevention and other mental health needs right now. Thank you for sharing that. And yes, I mean, there's some really good counter messages that are happening. I'm seeing that folks are starting to drop off the call. If you don't have any questions, thank you for joining. I don't know if you can see me. I don't think you can. I'm waving. Thank you so much for spending an hour and a half with me today. And if there's anything that we can do to advance your work. Oh, you can see me? Oh, great. Oh, I use my hands when I talk. If there's anything that we can do to support your work, we are 110% here for you. And I hope that there was some ideas that you could that you can use. I'll also do a shout out. I'm planning on doing one more webinar at the last week of May, and it's going to be dealing with opioids in older adults. So if you have not developed a logic model, and that's going to be very spiff heavy, it's going to be looking at how we develop a logic model to address opioids in older adults, because I know a lot of coalitions are working on that, but don't necessarily have really good logic models. So if that's of interest to you, tune in the last week of May, webinar Wednesday, and we'll be talking about that. All right, folks, I'm seeing a lot of folks saying thank you. Please feel free to get off the phone if you don't have any more questions, but please feel free to stay. We've got a few more minutes if there's any resources that you would like to know more about. I'm sad that we're all saying goodbye, but it was fantastic to connect with you, and continue to keep doing the great work that you're doing, because we're learning from you. And we're all in it together. I'm looking at the comments. If you need to get the poster, just training@cadca.org. They have this PowerPoint, and all of the materials will be sent to them. You guys are giving me warm and fuzzies. Thank you. Thank you for all you do. Yes, the link will be, I think it's on the website for the opioid training at the end of May. It should be on the website, but yeah, it is on the website. I know I talk fast, Heather. I'm sorry. I'm French Canadian and I can't control that, although I try. I get excited and I just get fast. I'm sorry. You should see me in person. Heather, there was a lot to get through in an hour and a half. But still, I know I talk fast. Oh, thank you. Thank you for the happy Mother's Day. Tampa Bay. See, I knew a lot of my people were on this call today. I'm going to stay on as you folks. I'm really appreciating the chats, and I'm still watching them. But if you don't have any other questions, you've got 10 minutes of your life back that you don't need to sit on a webinar. Thank you so much. Any resources that you want to get or you want to share, training@cadca.org, but you always can email me to chaneymom@gmail.com. It might take me a couple days to get back to you, but training@cadca.org, that's the place to go. And CADCA community, people. I love you all. Maybe I'll show you my puppy. I don't know where the little box is, but for those of you who are still on the line, here's my puppy. His name is Charlie. He's my youngest. All right, if anybody has any questions, isn't he cute? He came from a puppy mill and I needed a fourth dog like I needed a hole in my head. But you know, he didn't bark during the session. Nice to meet you too. I look forward to meeting you all in person at some point. So if it's not at mid-year, then another virtual training. We'll get back to normal someday, won't we? We will. Thank you, everyone. Isn't he cute? I know. You should see my hairless cat. Good. I'm glad there was good information, Heather. Again, training@cadca.org. Oh, Nonia, I didn't know you were on this call. I know, your new puppy. So cute. Thank God for Facebook. If anybody wants to join me on Facebook, just Google Dorothy Cormier, or Google, Facebook, search for Dorothy Cormier, Cormier, Chaney. Where's my cat? My cat was here, but she went away. Sometimes she stands on my shoulder and people think that they were good today. Thank you, everyone. Oh, Donna, nice that you were on the call. I'm still here if anybody has any questions. Is this video recorded? I think it was recorded, and that's a good question for training@cadca.org. Sandra, we'll see you at the end of the month if you're interested in developing a logic model for opioids in older adults. CADCA just said yes. So the webinar Wednesday for the last week of the month, I think it's the 28th, whatever that Wednesday is, I'll be doing a webinar Wednesday on developing a logic model for coalitions who are working on the opioid issue with the older adult population. And that can be found, the link for the registration for that can be found at cadca.org. They've got a list of all the webinar Wednesdays. Well, Sandra, I love logic models, so I'll probably be wearing something very special that day for that webinar because I am all about the logic model. So, so we'll be building a logic model together for opioids in older adults. Go Tampa. We don't teach in Tampa anymore and I miss that. I'm still watching the chat box and I'm watching the number of participants reduce and it's making me a little sad, I'll admit. So if folks have any questions, you're welcome to, I'll be on for the next 5 minutes with Monib. And so, oh, West Texas. Thank you. We're going to be in Dallas later on this year. Well, Charlie liked talking about that. Awesome. Thank you. Thank you, Clarissa. Thanks for joining us. And thank you for all you do, guys. My dog, Kimberly, I'm going to tell you, my dog is so cute. Like, I shouldn't have a puppy this cute, but yes. Thank you. He's very cute. I love him. What kind of dog? He is a very badly bred Cavalier King Charles Spaniel. And before when I first moved to the United States from Canada, I was the executive director of a no-kill humane society, Margie. So I've done animal rescue forever. And I've got a call that there was a dog, a baby dog that was needed to be bottle fed at a puppy mill. And so here came Charlie. So he's growing like a weed now, but he started out pretty rough. But he's a Cavalier King Charles Spaniel, or whatever they bred. I don't see any questions in the Q&A, but I'm still watching that too. And again, if anybody has any questions, we're still here for the next few minutes. If not, thank you guys so much. It was fun spending time with you, and thank you for all participating in the call. Oh, West Africa, thank you so much. I work on the international side of CADCA too, and one of my dreams has been to work in the Africa projects. I work in Indonesia and Albania, but we'll be doing it virtually for a while. So greetings from Wisconsin to West Africa. I hope to get there with CADCA someday. Tanya, I hope all is well, my friend. Thank you. Thank you. I don't think we have any more questions. Ooh. Okay, down you go. We've got 2 minutes left if anyone has a last question, but I'm thinking at this point they don't. So I'll thank you one last time. Thank you everyone for joining us today. It was great spending time with you. It was fun. Thank you. Thank you, everyone. I'm going to sign off now. Thanks for all that you do.